think there's an area of focus that we need to really look at, and that is patient experience. It is the patient experience, and how can we improve that patient experience? Unfortunately, at least as far as I know, in developing countries, experience patient focus centered care is not really the model of care that is provided, because so basic and so skeletal, it's not even worried about getting the service rather than the quality of the service or the experience from the service. And then you end up having a very bad experience, and that would lead to a delay in people accessing care and looking for care and even making decisions to get the care. Because if you've had a bad experience, you don't want to repeat it. You would hesitate to go back and get the same experience again. Making services patient focused. And one of the ways you do that, in my professional life, I've learned that what doesn't get counted or monitored is not improved. So we have to have systems in place where we are monitoring patient experience, especially as relates to maternal care, where we can track and can get feedback. And that feedback is an indication of some kind of performance measure. And only when you have that is when you start to see improvement.
I think it's really interesting, the focus on person-centered care.
Yeah.
Implementing those in those kinds, I think, are going to be really useful.
Yeah. At the moment, I don't think there's an adequate system, because this is part of the three. The last one is the infrastructure. No proper system to monitor the care, because if things are not monitored, then it can be improved, like Mr. Ukonu said. And I've also a lot of report on disrespectful care. I don't know if you heard about it, Jennifer. Women are being beaten, midwives or slapped, especially when they see younger women or teenage girls have babies in the hospital. They are very disrespectful. And you can imagine if they go to the traditionalist or some faith-based centers or clinics to give birth and they have better care, I don't think they want to go back to the hospital. So it's important we are talking about here. And at this point, I would like to speak directly to healthcare practitioners and providers. And experience is very important. Women's perception of healthcare is very important. If we're advocating for women to use these centers, then you all will have to do better in creating the right experience. So welcome back, Mr. Ukonu. You were talking about the monitoring system. We're just agreeing with that without a proper monitoring system measuring experience, then it's difficult to improve the system.
Once you have systems that enable for monitoring, feedback, and using that as some kind of performance indicator, then that will drive improvement. More of challenges come because nothing is being monitored, nothing is assessed in terms of performance, and nothing is sanctioned or rewarded, and therefore nothing improves. So, and this goes right up to policymakers, to politicians, and even to society. Social scientists. Is also important to hopefully even monitor attitude towards maternal issues, towards pregnancy, and so on, so that we can start to develop those messaging and target those messaging at the people who need to get the message. Because again, as society, if we're going to tackle the problem, and it of course is a huge problem, then we as a society have to take greater responsibility and action.
Absolutely. I think one thing we're going to talk before we begin to wrap up podcast is emergency obstetrics care. Are these strategies? I was looking at the United Nations Reproductive Agency strategies. It's called the 2 hours to save life. where they've been using drones to supply blood during emergencies. So these are some of the strategies that can be imbibed in developing countries, especially in a country like Nigeria, where they are contributing significantly to maternal mortality. I think that's one of the highest contributors to maternal mortality, up to 1,000 deaths per every 100,000 live births. These are numbers that need urgent and strategic action. So drones is one that can be used, but who is even looking into all this to ensure that we have these facilities? So I don't know if there are any suggestions. What are the other strategies that are out there that can help to tackle care developing countries?
Can I step into this?
Yes, please.
I think before we go on drones, let's start with the basics.
Okay.
There are basic things that systems need to get right before they talk about all of these advanced technology. And the basic is water and sanitation. I was executive director of RALSI, Rural Africa Health, Water and Sanitation Initiative. Our focus was to teach frontline health workers on the importance of water and sanitation. Washing is very important. You get people to wash their hands while they're in medical facilities, while they're handling patients, while they're treating patients to reduce infection. You ensure that when people eat, they consume their water and their food, that those food are not contaminated by material. Do they have sources of clean water and sanitation within the hospitals itself? A lot of those hospitals do not even have that. Do they have protection equipment, PPEs, to make sure that when they treat patients, that they are not passing infection from one person to another? Can they dispose of medical waste? And is waste disposal in communities itself something that is being prioritized? About diarrhea from open defecation, from water contamination, and so on. These are the basics. And then if you manage to get those basics, then the next level is, can you get the primary? Electricity. In healthcare systems, we don't have constant electricity to run the machines. So you cannot have diagnostic machines. You cannot have fridges that are reliable to even safeguard vaccines, blood banks. All of those things run on electricity. So it is when you have those, then we can start looking at drones and technology. But I think for developing countries, you have to start with the basics. You have to do the primary. You have to have the medical professionals on hand to do those things. And then hopefully we'll get to the point where are now more advanced to do other stuff.
Yeah, thank you. I think I quite agree with you. I don't know what you think, Jennifer. Yeah, I quite agree with that.
I think I would add that it's important that we adopt a data-driven approach. All the research that has been done, understanding what the key contributors are to pregnancy-related deaths. It's going to be really important. One of the top ones tends to be hemorrhages, bleeding, of the case studies that you just gave, infection, Ukonu's touched on that, sanitization, things like complicated labor, but also what about things like abortion? You're in a culture, in a society where pregnancy is deemed a shame, a stigma, you're going to try and go for abortions. And if you don't have money, you're more likely to do unsafe practices. Mm-hmm. So it's really about, kind of network of data where we can say, what are the major contributors here? And then when we identify those, when we've collated all that information, we need to start saying, how can we tackle this? So, for example, there's lots of bleeding, hemorrhages. Do we have nurses trained on this? Do we have available? Is there a proper campaign donating or giving blood? Do we resolve this issue? It's to do with pressure. Are the nurses trained? Are the tablets available? So it's about stocking and having supplies and training related to the key needs of that community. And I think once we start looking at it in that way and looking at the data and focusing and just kind of one at a time, really try and build structure that can support progress in each of these areas, then I think we can really start to see change.
Yeah. Thank you, Dr. Jennifer. That was really good. And thank you, Ukonu, as well. I think touch on one last thing. No, this issue just keep popping up in my mind. I just keep saying one last issue. I'll touch on the issue of mass migration of healthcare workers, because talking about all of this training and healthcare facilities and perception in healthcare, we need workforce, and it's depleting in Nigeria because all our fantastic and wonderful doctors are all finding greener pastures in the Western world. So what can we say to this, Mr. Ukonu?
I say that we can't really blame them, unfortunately. You have to recognize that people in general, human beings, will seek for the best outcomes for themselves. And that is not a bad thing. As human beings, that's what we are designed to do. Now, what is then the onus then lies on the politicians, the policymakers, to create that enabling environment for them to train and retain their workers and ensure that those workers are in a safe space where they feel valued, where they feel important enough to work and be appreciated and rewarded for their labor. Have to create a society where you attract people. So you can't expect where you have non-functional health facilities, you don't pay your workers, you owe them salary months on end. And when you do pay them, the salaries is not adequate to live a decent, dignified life. And you expect them to stay in that environment. That is not a practical and realistic for anybody, especially people who are highly skilled and their skills are in demand across the globe. Has made it such that people are able to transfer their knowledge, transfer their skill, and people will take their skill to the place where they feel they will be most rewarded for it, and they'll feel more comfortable and safe and appreciated. So it comes back to the governments, the politicians, the policymakers to create that environment.
What I will just add to that is, how much can we rely on our governments to do the right thing? Particularly when we think about a history of colonization and the issues and the disparities and inequities. So for them to actually have the capacity to build an environment that people are going to want to stay in and work in, that capacity is in question, because there is a lot of Western influence within Africa that hinders some of the progress. And what I will say is, in terms of, and I was watching a documentary, I think it was on the BBC, called The Brain Drain. And what I feel like is, while our governments should have a degree of responsibility, I feel like the Western governments also have responsibility for ethical practice. And I think it's unethical to take thousands of people from very struggling countries, take their expertise, you take their brain, you take those things, and you plug it into your economy and into your system. What does that say about the country that's been left behind? Are they ever going to be able to make it? Is it sustainable? Are they going to be in a perpetual state of disadvantage as a result? So I think there needs to be ethical considerations, and there needs to be barriers in place and parameters set out to ensure that these countries are not continually taken advantage, because it just looks like another modern day kind of, in a sense, where you're bringing people to your country to build your economy. It's a similar sort of thing. It's a similar sort of mindset. And if you're going to really have a chance, I think, yes, the government needs to make changes, but I think the Western world needs to also put some ethical parameters in place, and perhaps not create systems that mean that in training the expertise from these developing countries, but actually put some system in place to help developing countries get on their feet. I think it's two ways. It's a difficult one. I think there's a lot of ethical considerations there.
I think you just took the words from my mouth, Jennifer. Exactly what I was thinking. Ukonu, do you want to respond to that?
Well, I hate to sort of disagree with two ladies on the subject of that, but I do slightly disagree. I think I get where you're coming from, for both of you. I get where you're saying there is an ethical or moral point of that, but governance is not an ethical or moral issue. the national interest of any country is not a moral or ethical issue. It is a selfish interest. These Western countries are concerned about their own citizens. The countries of the developing countries should be more concerned for their citizens, to the point that they create that environment for their citizens to want to stay. And what's so difficult about making Africa and the developing countries the place where Western want to come? Why can't we attract them from the West? Why is that not a possibility? So it's. I think we shouldn't absolve our leaders of that responsibility to look after their own. They have to invest. I mean, and what does it say when African leaders leave their own country and seek medical help abroad? They're the ones who go abroad to seek medical help. When they're sick, they don't have hospitals in their own country that treats them adequately, and they run abroad. So what message are they sending to their own doctors, to their own health systems? So we cannot absolve them of that responsibility. It's their duty. They aspire for office. They get into power. They have the resources of the collective wealth of their countries. They should use it to invest in their people, train up enough people. In a country like Nigeria, for example, the official figure puts unemployment at about 35%. Unemployment in a country that's full of young people. Why are these young people not in schools, not in trade, not in jobs, not being recruited? So it's not a question of somebody's taking capacity. And in fact, it was even a minister of labor who once boasted that they are fine with losing their doctors and losing their nurses, that they have enough. They said so. Far from being exploited, they boast that they can afford to lose those doctors. So I put the responsibility squarely where I think it belongs. And it is for people in government to take the responsibility and fix their systems, create the culture, create the infrastructure, create the resources to protect our women and the future generations. So it's not just about, and I
think we've lost you.
It's not just about protecting women here. It's about protecting the future generations to the next
generation. Yeah.
I wanted to just respond to some of what you were saying. Yeah, we can hear you. It looks like you were dropping off a little bit there.
Yes, we can hear you now, Mr. Ukonu.
Yeah, I was going to just respond to what you were saying.
That's my point.
The joint's responsibility. The reason for that is because we cannot underplay the impact of history and Western influence in Africa. We just cannot underplay it. And I think, sadly, a lot of people are unaware of the historical significance of events that have created a situation where Africans are unable to stabilize themselves or support themselves. So I think that cannot be underplayed. I think we're attributing too much power to our government, because even though they're in charge, psychologically, mentally, economically, they're really not in charge. I think it's understanding the Western interference and how that has impacted on the psychology of the African man or the African woman or the African leader. And I think that can't be underplayed. I think it's really important to understand that. And in terms of just looking at changes that can be made, I think we need partnership. We can't do it on our own. We need partnership.
I do agree. I think, yes, the global community certainly needs to support developing countries. And when we talk about the SDGs, Sustainable Development Goals, there's a focus and there's a responsibility for developed countries to support developing countries. I don't doubt that for a second, and I get that. And of course, also the point you made about the historical context of the influence of colonialism, enslavement, and so on and so forth. I get that. But I do stress, and I think it's important to always make this point. There is no Western government that is stopping the president of any country from building hospitals in their country and not running away to the West. There's no Western country that is stopping the tools in their own country. giving opportunity for them to train their nurses, their doctors, equipping their. So when they fail to do that, and they have failed to do that, I think we have to put the responsibility on them.
I know our time is far gone, but I was just going to mention Vasu making lots of strides in this area. I don't know if but they're doing in terms of infrastructure, building schools, building like the reins of their country and making changes. So I think they're a very good example for other countries to follow suit and see what's going on. A lot of the advancement they're making comes from the current president saying no to a lot of Western interference and actually saying, no, we're going to build our own private jet. No, we're going to do our own. So Burkina Faso, I think, is a fantastic example of how Africa can start to rise and make those changes. And in terms of that no Western country can support, stops leaders from supporting their country, you have to understand the rules of war, the rules of domination. It's very much a case of divide and conquer. Example, Congo that has been in war constantly. You'll be surprised to find that the weaponry is supplied by France. So they're in war, they're killing one another, there's division among those societies, and the supplier is France. So it's almost like they're distracted, they're divided, they're fighting one another, not the mindset for building an economy. So I want to just stress that there's so much going on underneath that really makes it difficult for Africa to make that progress. But we are getting there, and Burkina Faso is an example of that.
Yeah, I would also throw in Rwanda into that. At least my brother lives in Rwanda. They seem to be making huge strides. Yeah. Countries, African countries and developing countries can make those huge strides. And I will just take a message that was used during a drug abuse campaign in the United States a long time ago. When the West comes to those African countries to try and corrupt them and divide them and rule them and subjugate them and get them to steal their resources, they should use this phrase, just say no. No.
If only it was that easy.
Just say no. Oh, this is very interesting conversation. I'm delighted to be having this conversation with you too. Also emphasize of good initiatives going on. I think you mentioned Rwanda, in Rwanda's healthcare, even in Senegal. I've seen the project Schools for Husband engaging men in reproductive health. I've seen the Sri Lanka and Rwanda also initiative, and these initiatives have reduced maternal mortality from 450 deaths per 100,000 live births to nearly 30. And how have they achieved this? They're using health workers, digital alerts. So these things that can be done. Even in Tanzania, they are doing the simulation training to improve clinical care and for monitoring care and creating scenarios that can use to improve care. So a lot of simulation training going on there. So a lot of improvement we are seeing, but it's so disheartening that not seeing much from Nigeria. But we want to see some of these initiatives in Nigeria being implemented in the areas, in rural areas, to improve maternal. You have said there's responsibility. I think the Western world has a responsibility. I won't say Western. We have a global responsibility as global citizens to come together to improve outcomes for women. It's not just a battle for Nigeria. It's not just a battle for Ghana or for India. It's a battle because we must reduce maternal mortality. I think this goal is to reduce it to 70 deaths per 100,000 live births. I'm still very skeptical we're going to achieve it, but I believe that if we take on some of these advice and some of these initiatives that have worked somewhere else and try to implement them judiciously within our own context, and our government pays strategic attention to maternal care, I think something can be done. So on that note, I would like to give Mr. First, maybe I'll come to you, Jennifer, first to make your last comment and feedback, and we'll hand over to Ukonu to make his last remark before we call it a day.
I think we've spoken so many things and a lot of food for thought. But we're in the right direction by having this conversation. It's a start. We're creating awareness, and like you mentioned, technology, drones, things are being done. So it's really about just creating awareness and making people, know there is help available, and helping mothers gain that voice, helping women gain that voice in rural communities. But I think it's also looking at historical contexts, cultural contexts, structural contexts, political context. There's so many domains that really need to be looked into so that we can start to adapt policy and make changes.
Thank you, Dr. Jennifer. Yeah.
Okay. Yes, as Dr. Jennifer said, these are important conversations to have. But before I even jump into mine, I just want to give a shout out. Since we're giving shout outs to countries who are doing well, let's countries who are doing well. So South Africa, Kenya, Tunisia, Algeria, Botswana, Rwanda are the top African countries in terms of good health systems. So shout out to those countries. Now I want to just sum up by making an appeal to African leaders. And please, anyone watching this, share this, get the word out to those politicians, to those leaders, to those policymakers. Get them to understand that this is about saving our generation, saving our women, saving our future. We have to investing in our own people. We have to start investing in the infrastructure, in the systems, in the policy. We have to start training the right healthcare professionals. We have to get the equipment, get the basics right. Because if we don't, then we're going to end up in an endless cycle of death, of destruction, of inadequacy, and eventually we will lose our own essence as a people. So that is my message. We have problems, and a lot of it, we know what the problems are. But it is about solution, and the solution will come from people, will come from policymakers that will change that culture and change those healths for the better.
Yeah.
Well, I finished.
Yeah.
Thank you. Yes. So it just changed for the better. So that was.
Yeah. Thank you guys so much. This was an interesting conversation, and I hope you're back again to the podcast. So thank you everyone for watching. Bye-bye.
Thank you.
Thank you for watching our Mother's Health podcast today. Remember, every mother deserves safe birth. Bye-bye.